Hello, everyone, and welcome back to the Road to Pregnancy podcast, where we provide you with pregnancy-related information and local accessible resources here in Rhode Island. I'm one of your co-hosts, Ashley Houlihan.
And I'm your other co-host, Malia. We're so excited to have you join us today for another episode about genetic testing in pregnancy. We did want to give you a quick disclaimer that we will be touching on more sensitive topics in this episode, like terminations, fetal loss, and difficult diagnoses.
In our first genetics episode in Season 1, we focused more on the screening tests that you can expect in the first and early second trimester. In today's episode, we're going to be exploring what may happen if you receive a positive test result, some of the diagnostic testing you can expect, and what your options look like if you receive news that you weren't hoping for.
And we're even more excited because Dr. Margie Thorsen is back on the podcast to help break things down.
Dr. Thorsen is a native Rhode Islander who completed undergrad medical school and OBGYN residency here at Brown. She's currently in her last year of maternal fetal medicine fellowship at Women and Infants, where she's doing extra training to learn how to take care of women with more complex pregnancy conditions.
You may see a maternal fetal medicine doctor during your pregnancy to get certain tests done, or if your pregnancy becomes higher risk. They talk a lot about genetic testing, so Dr. Thorsen is the perfect person to help us out in this episode. She has specific research interests in medical education and health equity, and is also a mom herself, so she can relate to a lot of what many of you are experiencing.
Dr. Thorsen, welcome back to the podcast. Thanks for coming on again.
Thank you so much for having me. What a pleasure.
Let's start with a little memory refresher from Season 1. You get a phone call with that initial positive result from a screening test, like the NIPT or the NT scan. What do the next steps look like?
Yeah, so I think first and foremost, really it's important to remember that this is a screening test. So if you had an NIPT or a cell-free DNA test, that's a screening test. So that tells you if there's a higher chance or a lower chance that the fetus has a chromosome disorder compared to the general population. And really, this is an opportunity to be referred with a provider that has experience with genetics and can counsel about next steps. Typically, locally, that means meeting with one of our genetic counselors, and at that point, discussing what the test result might mean and options for further exploration of the specific condition. In particular, ways that we might be able to give a diagnosis or do a procedure to actually get you a yes or no answer.
Okay, so your care team kind of expands a little bit maybe after that first positive result. Who kind of comes on and starts being a part of your care? Are you still seeing your regular OBGYN? Are you only seeing MFM?
Yeah, at that point, it really depends on the model of care and the practice that you're seeing. I'd say that locally, most people here will meet with a genetic counselor, get more information, decide what testing they do or don't want to pursue, and then the results of that testing or kind of the patient preferences will guide the next steps in who their care team is. There's not a one-size-fits-all model. We really meet patients where they're at and work closely with lots of different practices across the state.
That makes sense. Okay. So you've met with your care team and they're discussing the next steps with you. Diagnostic testing options may include either CVS or an amniocentesis. So let's start by discussing the CVS. What is this test and when during pregnancy can it be done?
Sure. So I think first and foremost, thinking about what are these tests globally. So both a CVS, which is a chorionic villus sampling, and an amniocentesis are a way for us to use either a small needle or a small flexible tube to take a sample of pregnancy tissue or fluid from within the uterus. And this is a way that we can actually look at the cells of the pregnancy to understand what the genes are of the pregnancy. So a CVS is a way for us to take a sample of placental tissue, and that's usually done around 11 to 13 weeks of pregnancy. An amniocentesis is taking a sample of amniotic fluid, and that has to be done a little bit later in pregnancy, around 15 to 20 weeks, because the pregnancy doesn't actually form a lot of amniotic fluid until later in the pregnancy. So they're two different types of tests, and there are some sort of unique differences between the two, but really the test that you have done depends on what point in the pregnancy you're seeking a diagnostic test. And whether you get a CVS or an amnio is really dependent on where you are in the pregnancy at the time of that test.
Okay. Are there any other factors that go into choosing which to get besides the time that you are in your pregnancy?
Sure, some people want to know really early in the pregnancy a definitive yes or no answer about specific genetic conditions. Maybe they want to know specifically about aneuploidy, so things like Down syndrome, trisomy 13 or 18, or they want to look for a very specific genetic syndrome. Those are things that we could do earlier in the pregnancy with CVS versus waiting a little bit longer for an amniocentesis. Both procedures are similar as far as the patient experience. They can both be a little bit uncomfortable, but overall are very safe procedures. They're usually done in the ultrasound unit, so there's something that you come in for, you have done in the ultrasound room and are able to go home the same day and take it easy, but it doesn't require you to be admitted to the hospital or anything like that. Both procedures have a very rare risk of infection, may cause some bleeding or spotting, very rare risk of miscarriage. We think for CVS that risk is maybe 1 in 300, and for amniocentesis, more like 1 in 1,000 chance. So both overall very safe. One other thing to think about with CVS and amnio is that an amnio is always done through the abdomen. Sometimes a CVS is done vaginally through the cervix if the placenta is best reached through the cervix. So sometimes a CVS is done with a vaginal exam, and sometimes it's done abdominally. But an amniocentesis is always done abdominally. And that decision about how to best approach a sample of tissue is really going to be something that's guided by your anatomy, your placenta, the time of pregnancy that you're seeking this care. And that's usually something that's decided by the doctor who's performing the procedure. But it is a small difference to take into consideration.
And are patients awake when they're getting these tests done? And is there any local anesthetic that's given for the needle insertion site?
Yeah, that's a great question. Yes, patients are awake, and we do whatever we can to make you comfortable during the procedure. And the setup, I always say, takes longer than the procedure itself. So a lot of the stress of the procedure is the anticipation, but the actual procedure is usually very quick.
And you touched on, obviously, some of the benefits of getting these types of tests done would be getting that definitive diagnosis. But just even more broadly, what are some of the benefits of getting diagnostic testing done? How can that help you prepare in your pregnancy or make decisions?
It's a really interesting question. I'm very lucky to practice in a state where we are not necessarily as time crunched when it comes to offering people different options for their pregnancy. When people know that the information that they receive on an amnio might change their pregnancy plans, we are not in as much of a time crunch as other places in the country are to get a result. In particular, when people find out that they have a pregnancy affected by trisomy 13 or trisomy 18, those are conditions that can cause pretty significant lifelong disability, and many babies don't survive labor and delivery, or oftentimes not beyond a year of life due to the significant disabilities. And that may be a pregnancy that somebody decides they don't want to continue. And that's something that is a very personal choice, and there's not a right or a wrong answer there. But in the state of Rhode Island, we're not up against a huge time crunch for people to make that choice. So we don't typically have people opt for a CVS or a CVS over an amniocentesis due to really strict guidelines about pregnancy options in the state. But that can be a consideration other places. I think really important to know is that SMFM, which is the Society for Maternal Fetal Medicine, and ACOG, the American College of OBGYN, really emphasize the importance that people don't make an irreversible decision about their pregnancy based on a screening test. So if you have a high-risk screening test, like a high-risk cell-free DNA result, it's really important that you meet with a genetic counselor and talk about diagnostic options because, again, there can be a really high false positive rate depending on a host of different factors, including the age of the patient. So just something important to bear in mind when thinking about how to interpret all these results.
Great. And on the flip side, I know you kind of talked a little bit about the risks of the procedures, but can you talk a little bit maybe about some other cons that can be associated with having a diagnosis from one of these procedures?
Yeah, I think sometimes people might find out that they have a specific condition. So sometimes people might be looking for something that they know they're at risk, their fetus is at risk for based on carrier screening. For instance, if both parents are carriers for cystic fibrosis, they might want to know if the fetus is affected by cystic fibrosis. If both of the parents are carriers for sickle cell trait, they might know that they have a child affected by sickle cell disease if the amniocentesis result comes back positive for that. Depending on the condition, sometimes there's not anything different that we do in pregnancy. Sometimes there's not anything that we can do to change that diagnosis. And so for many people, knowing the information can help them to make a pregnancy plan. Sometimes it changes pregnancy plans for people, whether that's choosing adoption, termination, or making a plan to have a specialized pediatrician and making plans about how they're going to care for this child after birth. But for some people, more information is not helpful and it causes a lot of anxiety. And for other people, more information is helpful in whether it changes their plans or helps them to plan ahead. So I think really the con is more so if people don't know what they would do with that information, and getting unexpected information that you don't know what to do with can be a con. So thinking critically, how would this information change what I do or how I feel about the pregnancy?
Thank you for clarifying that and emphasizing that it's really a personal decision that you have to make and decide what that information will do with you. So just reiterate, is if someone decides they don't want to do this procedure, they have the positive screening result and they're like, I don't think knowing this would change my pregnancy in any way, is that okay?
It's totally okay. It's a very personal decision. And I think another piece of it is sometimes a positive result helps us to do more ultrasound care, to have a closer eye on the pregnancy depending on the condition. So diagnostic testing is certainly something we talk about, but we also think about what kind of ultrasound should we do during the pregnancy and what kind of care after delivery should we be thinking about as well. So there's more than just the immediate diagnosis that comes to mind. There's also some surveillance, I would say, with ultrasound care.
Okay. And so if the diagnostic test comes back positive, do you have any advice about coping and processing with that news?
Yeah, it's so complex. I think there's so many different conditions that we can look for in diagnostic testing, far more than we can look for in non-invasive prenatal testing or cell-free DNA. So I think it's really important to remember that low-risk cell-free DNA can tell us that you're not at high risk for one of the major 3 aneuploidies or sex chromosome aneuploidies, but it doesn't tell us about all the genes of the growing pregnancy. In diagnostic testing, we have a lot more different ways to look at different specific genes of interest and really to investigate a lot more clinical questions that may come up. So that's a really hard question to answer, and I'd say really should be answered in conjunction with a genetic counselor based on what we're looking for.
And what are the options that are available to someone if their test comes back positive? What are the types of things that, you or a genetic counselor would present to the patient as ways of continuing the pregnancy, terminating the pregnancy, or, like you said, surveying and planning?
Yeah, I think it really should stem from patient values and what information they want to hear. And I think learning about all the options that they have, finding out what people do or don't want to know, do or don't want to talk about, and really taking the lead of our patients and following their values in the discussions that we have. For people who find out about a condition that may be incompatible with life or find out about a condition for which they would not want to continue a pregnancy, and that can be so complicated and so personal. There can be so many different reasons for that. In the state of Rhode Island, we do have the ability to provide people a referral to family planning at Women and Infants or Planned Parenthood family planning if they wanted to discuss options for pregnancy termination. Usually that's up until the end of the 22nd week of pregnancy. And for people who want to continue the pregnancy and want to meet with subspecialists who are experts in taking care of people who have a pregnancy complicated by a fetal genetic condition. Those are patients who oftentimes will be seen in collaboration with maternal fetal medicine for their care, both prenatally in prenatal care and also for ongoing ultrasound care.
Okay, and is there any chance that the results from the diagnostic testing come back as inconclusive? And how do you counsel patients if that's the case?
Yeah, there's always a chance that we do diagnostic testing and aren't able to get a result. That can be very frustrating for patients who go through that experience. And I think in those circumstances, it's important to talk to a genetic counselor about what we could do next. Sometimes repeating the test makes sense, other times it doesn't for that patient, and sometimes repeating the test might not yield an answer, so that's really a nuanced conversation.
Okay, and something that I wanted to ask too is what are the limitations of these diagnostic testing? Are you able to, diagnose that my baby is going to have autism or something like that?
Such a common question and such a complex answer. I think that there's really specific genetic conditions that we can look for. Autism is so multifactorial that's not something we're able to look for. There are certain genetic syndromes we know that we can look for, especially if they run in families, or we know that people have are a carrier for a genetic syndrome that could affect cognitive development or be associated with a developmental delay. But there's not a one sort of all-inclusive test for autism, and nothing on ultrasound or prenatally can we do to really know which babies will be affected by autism.
Okay, thank you for clarifying that. And something that we haven't really touched on yet is the role of ultrasounds in genetic testing. So say that someone made it through the screening tests without any positive results, and now they're getting their regularly scheduled ultrasounds. At about 18 to 22 weeks, they will probably get the detailed anatomy scan. And so how does that fit into genetic evaluation?
We usually think of ultrasound and genetic screening or diagnosis tests as really being complements to one another. Sometimes we see things on ultrasound that make us more suspicious for a genetic condition, and sometimes we see things in genetic screening or diagnosis that make us look for certain things on ultrasound. So really the two hand in hand are helpful. And like I mentioned, with cell-free DNA, we're not looking at every single genetic condition, but there are certain things we can see on ultrasound that we would never see on cell-free DNA that might prompt us to say, maybe you should meet with our genetic counselor and talk about diagnostic testing. For instance, if people had a very, very small baby, smaller than we would expect, so less than the 10th percentile, before 32 weeks of pregnancy, that might be a reason we think that baby's at a higher risk for a genetic syndrome, and maybe they should meet with a genetic counselor to talk about diagnostic options. There's other different things we might see on ultrasound that might also be a clue for genetic syndrome, and there are many times in ultrasound that we work collaboratively with our genetic counselors to think through the differential diagnosis and kind of work that out.
And thinking about it the other way around, how do you counsel patients when the screening tests may show increased risks or the diagnostic tests show something, but ultrasound findings are normal?
Yeah, it's really hard sometimes to explain how the genetics and the ultrasound are complementary but not always concordant, meaning that sometimes we think that a fetus is affected by a genetic syndrome, but we don't see any signs of it on ultrasound. And that doesn't mean we necessarily think that the genetic screening or the genetic diagnostic test was wrong. It's more so that not every baby affected by an aneuploidy has a positive finding on ultrasound. There are, a host of different things that we look for, and some of those things, if you were to Google them, you can look for soft markers on ultrasound for aneuploidy. The Society for Maternal Fetal Medicine has a nice consult series with beautiful illustrated patient education on that, as far as some of the things we look for on ultrasound. But many times we don't see anything on ultrasound, and it doesn't necessarily mean that there's not a genetic syndrome. So one of the many limitations of ultrasound is that it really can't tell us the genes of the baby.
Before we wrap up, we talked about a lot of sensitive and personal decisions in this episode. Genetic testing is a wonderful medical advancement for pregnancies that can help patients and providers be more informed, but we recognize that it can bring about a lot of anxiety, especially during those waiting periods where you so badly want to be preparing for a healthy pregnancy, but you have that test and that diagnosis in the back of your mind. So do you have any last pieces of advice or words of wisdom for people who are in that position and going through this process?
Yes, I think it's really helpful to think about these all in the framework of what information do I want to know and what wouldn't I want to know? And how would this information help me make a decision, or how would it inform me moving forward throughout the pregnancy? Really, genetic screening and diagnosis are optional. They can be tools to help us plan ahead and tools to help us learn about the pregnancy. But not everybody has the same priorities, and not everybody wants to know the same things. And I think it's okay to ask. It's okay to really question and get the answers that you need when making a decision. Because like I mentioned in the last episode, we have so many things to cover when we meet you for a prenatal visit that sometimes this is not the top thing on your priority. And sometimes it's not the top thing that we're thinking about talking about. But if it's important to you, you have every right to ask your doctor or your midwife to talk more about it. And everybody can make a different decision based on what their values are. There's not one way to do this.
Yeah, that's great advice. Thank you so much again for coming on to talk to our listeners. We really appreciate you and all of this amazing information.
Yeah, thank you so much. We're grateful to have had you on twice.
Thanks for having me. It's been a treat.
Now, we can't end an episode without mentioning some resources available to you here in Rhode Island. Now, as we discussed, deciding how to proceed with your pregnancy after receiving a difficult diagnosis is a very sensitive and personal decision. There's no right or wrong answer, and there is support for you no matter what you decide.
If you decide to proceed with termination, your care team should talk with you about how, where, and when you can receive that care. But we wanted to mention that Planned Parenthood of Southern New England and Women and Infants offer termination services. Pregnancy termination or abortion is protected in Rhode Island until the age of viability, which is typically 23 weeks.
If you choose to carry the pregnancy to term, there are numerous resources in Rhode Island to support you and your family if you have a child with a genetic condition or with special needs.
The Rhode Island Parent Information Network is a nonprofit organization that offers free, multilingual support for families caring for children or loved ones with disabilities or special needs. They can assist with education, healthcare, and self-advocacy. They also have support groups to meet with other families or parents undergoing similar experiences.
There are many other programs throughout the state that provide similar support, such as Family Services of Rhode Island, the Early Intervention Program, the Katie Beckett Program, East Seals Rhode Island, and the Seven Hills Foundation. All are linked below in the show notes, and you can discuss with your care team, pediatrician, or social work if you think you could benefit from them when the time comes.
Thank you all so much for tuning into today's episode on diagnostic genetic testing in pregnancy. We know that this was a little bit more of a sensitive episode, but we hope that you feel more informed about your options and can understand more of what the diagnostic process may look like.
And we want to acknowledge that none of these decisions are easy, but your entire care team is there to support you. Don't hesitate to ask as many questions as you need and speak with them about extra resources or support groups that can help you on your journey.
Remember to follow us on Instagram at Road to Pregnancy for updates, helpful tips, and more pregnancy-related information.
And please share this episode with anyone who may want to learn more about diagnostic testing in pregnancy.
See you next time.